Well, we've put quite a lot of information in the book about how we should intervene using something called response to intervention. This is very popular in the United States at the moment. And essentially what it means is that you identify problems that a youngster's having, and in whichever area you're interested in, whether it's maths or reading or whatever. But let's stick with reading. So we check children from a very young age, and we identify all youngsters who are struggling to learn to read. And we don't wait for them to fail for years. We don't send them off for diagnosis years later. We don't come up with categories. We simply say, here, all these children are struggling. We need to provide them with additional help. And so you give these youngsters additional help, and hopefully some of them will make progress and they'll go back to their kind of normal resourcing levels. Other children may still struggle or may get left even further behind. And what you do under this model is you increase the intensity of the intervention. You might reduce the size of the group the child's working in. You may even have 1-to-1 or 1-to-2 in terms of your adult-child ratio. And what you do is you provide additional resources. And the more help they need, the more help they get. And you don't need any underlying tests, you don't need any wherewithal, you don't need any diagnoses. You're just focusing on the behaviour you want, and you're intervening using the appropriate methods that scientific research has demonstrated to be most effective with these people. There are so many things I want them to take from it. Firstly, I want them to understand that the construct of dyslexia is highly problematic, and that really trying to get an assessment of this kind is not going to solve the problems if they have a child with complex difficulties in reading. I'm hoping that they will have a deeper understanding of the current state of knowledge of reading disabilities. Fundamentally, very important, I hope they'll really realise that actually decoding difficulties have nothing to do with intelligence, that we can make no assumptions about a person's intelligence on the basis of their ability to decode text, that it's criminal to assume that children are stupid because they can't learn to read very well, and that anyone who treats them like this, we must intervene and stop that from taking place. So I'm hoping that they'll take all that away, and I'm hoping that they'll realise that there are a whole group of children out there who struggle to learn to read, and for many, many different reasons, they're not getting the help that they need to make progress. And that really the way we use dyslexia actually allows that to continue much more than if we ditched the whole thing and started with the approach that we were advocating in the book. I approached Cambridge because it's, in my field, it is the most reputable, prestigious publisher. When people asked about the book, and I said I was writing this, and they looked at me and they weren't sure about where this was going, they said to me, "Who are you publishing with?" And I said, "Cambridge University Press." And immediately you could see them sort of look at, "Oh yeah, well." So there's a cachet of this. It's a very, very highly respected publisher in the field, and I was delighted they took it on.